Welcome back to Season 3. This season, we hope to uncover even more pearls of wisdom from our guests. Ali and I are excited to bring you some amazing guests this season. The theme of this season is unusual journeys, and we have quite the lineup of dental professionals to discuss all the different paths that dentistry can offer. And for our first guest, we have Chris, who is from Barry, South Wales. He graduated from Liverpool Dental School in 2012 and has since worked in a variety of fields, including general practice, emergency dental services, the University Dental Hospital, as well as in sedation and oral surgery referral practices. Chris has been involved in sedation since 2018, and he not only provides sedation for his own patients, but also offers roving sedation services and mentorship. He loves all things sports and outdoors, particularly water sports, including surfing and kitesurfing, and after graduation decided to merge his passions and undertook a master's in sports science, which has since led him to go back to medical school to train to be a doctor. So Chris, how was your week?
Yeah, very good, thank you very much. So I am coming off a bit of a cold, so yeah. And also, you know, when you're like, I'm not that ill, but you know when you're just still a bit tired, and so if I start chatting absolute drivel, just bring me back in. Hopefully I won't be doing that. But no, good. So I'm in my second year of medical school now in Swansea, and sort of getting into the groove, finding that groove at the moment. So no, good, enjoying.
Nice. So Ali, how was your week?
I feel like I say this every time. I had a good week, but a busy week.
Yeah.
And actually, this was the first weekend in a while where I've actually worked through the weekend, which is what I said I'd stop doing. I built admin days into my months, and I was really excited about that. And then every single day got taken up by something. So on Monday, I was in Bournemouth mentoring Harry on a full arch again, which was amazing. And I really enjoyed it, but it's driving back and forth. And then we launched our annual practice CPD event with Newport Orthodontic Clinic, and it's I'm actually really excited about this. We've got some really cool speakers. We've got maxillofacial surgery, we've got orthodontics, we've got restorative, we've got implants, we've got sustainability, perio, and it's called Myths and Truths. And what I'm really excited about is that it's cost people £50 to come, but that all goes to charity because we've had amazing sponsors. So if any listeners want to come to that, there's not many spaces remaining actually, but it's on the 15th of November. And then this week, Gareth and I were filming the demo videos for site-specific implantology, which you're helping with.
Yeah, I am.
Which will be awesome. And Gareth's really protocoled, so I'm really excited because we know off each other, we've worked together a little bit, but filming the demo videos, we realized how many tips and tricks each of us have introduced to our protocols. So that will be awesome. And there is one space left on the course, and that's at Celtic Manor on the 18th and 19th of October. So one space left, and so check out Instagram for details on that. And then I'm preparing for this Saturday's The Dentistry Show, and I'm giving a talk for the Association of Dental Implantology on our full arch digital workflow, because I found out we're one of the only places using a full arch digital workflow. And that's cool because we're getting really cool results with it, and we've obviously got a lab set up in-house, so just putting all of that together. So if you're at the dentistry show, and if this comes out in time, will it be out in time?
No.
Okay, well, if you were at the dentistry show, I hope you enjoyed the talk. And then one last cool thing I thought I'd bring up is we're working with a company, and I'm not going to say their name because we don't know if this works yet, but we're doing some digital marketing for the practice using AI. And I think that's pretty cool because the AI is basically helping us find the people that need our services. And if this works out, it could be a game changer because marketing in dentistry is absolute rubbish through agencies. Everyone who's ever used one will know. And I guess it's like with a good dating website. The information getting to the right people who are looking for the right people, that's the key. So yeah, that's everything that's been going on with me.
The Tinder of dental marketing.
Yeah, maybe not Tinder. Maybe,
Bumble?
Yeah, maybe something a little more refined than that, yeah. But yeah, how's your week been?
I've had a good week. I'm fresh to the recording from a half marathon down in Sussex, so which went really, really well. It was a lot hillier than I thought it was going to be. So my legs are very tired right now.
Did you nearly broke the
Yeah,
90-minute mark.
I did.
Wow.
It's been my goal for a while, and I was very close, but not quite. But I've just got to find a flatter race.
Still amazing.
And then, yes, I had 2 sustainability talks this week, which were all online. And I will say that's the great thing about sustainability talks.
Yes.
They're nearly always online. But it's quite weird to get used to sort of presenting to no one in your home. So that it is an unusual situation, I think. But it's really good that actually people don't have to travel for it as well.
At least you didn't forget and do what my friend did and stand up in his boxers on a international webinar with 600 people.
No way.
Or I guess the lesson is wear trousers if you're going to present.
It's funny you said that. It wasn't that bad, but this week, Wednesday morning, we had online lectures, and I was really tired. I'm an evening person, I'm not a morning person. So I was watching an online lecture, I had my iPad on my belly, and I was sat like this, sort of trying to wake up. And I obviously accidentally hit the video button. I had no idea. My phone's on silent, so I didn't know for about 10 minutes. And when I went on my phone, I had all these messages, all these screenshots saying, turn your video off. So that was embarrassing.
Brilliant.
Very nice.
So are they doing a lot of online lectures now as well at the medical school?
Yeah, it's probably 50%. So Monday's all in person, Tuesday's all in person, and then Wednesday morning is online. But then they call it asynchronous. So there's a lot of online content that you can do in your own time.
Fantastic.
Yeah.
Oh, that's really good.
Yeah.
Especially with your work schedule now.
Yeah, so it does help that, when it's flexible.
So I might be jumping ahead, but how does your week look typically?
So Monday's the case presentation in the morning, and then we have a couple of lectures from a consultant in that area. And then we go to the lab for the anatomy, the cadavers, the radiology, etc. So Monday's 9 to 5, and then Tuesday's our clinical day. So you do all the clinically relevant stuff for those diseases. So it might be RESP exams for asthma, for instance. Wednesday mornings, online lectures. Wednesday afternoon off. Thursday off. And when I say off, so you're supposed to be studying or supposed to do clinical placements that you have to organise yourself. And then Friday is a half day of in-person lectures as well. And then next week is start again, new module, completely different disease.
Wow.
Yeah.
Wow.
Right. So what drew you to want to do sport medicine?
So obviously I did dentistry first, and then I became a sports scientist, and then I did part-time of both for, I think it was 5 years. And I couldn't help but think that sport medicine would be the best balance of both worlds, because there were aspects of both that I really, really liked, and then aspects of both that I really didn't like. So I'm hoping that it'll be third time lucky and sport medicine will be that perfect balance. However, I don't think I'll say goodbye to either. I think I'll always do a bit of dentistry, because I do really like what I do. And also the sports science is so relevant for sport medicine anyway.
What is the difference?
Unfortunately, what I found was missing in sport science was the autonomy, and unfortunately, depending on what role you do, the money's very different as well. The money is good in dentistry. It's not as in the roles I was doing, even though I was doing quite well in good positions. It's just in terms of comparison, is not as good. So the autonomy is not as good, and the money's not as good. And I really like the autonomy, and obviously it's nice to earn more money. And it's very weird going from a full-time 23-year-old on a certain wage to then being a sports scientist age 27 on probably a lot less. Yeah.
And in terms of autonomy, do you mean autonomy within projects to make decisions?
Yeah.
Or autonomy over your own time?
Both. So dentistry, but when you're self-employed as a dentist, there's a lot of autonomy from a business sense, but also clinically there's a lot of autonomy. Obviously, if you're in practice, the buck stops with you. Obviously, it's very different in hospital, as a hospital dentist. With sports science, usually you're a small cog in a very, very big machine, and sometimes. So the irony is, in sports science you talk about limiting factors a lot, and it's really relevant to the athletes. But I found that too often I felt like the limiting factor was nothing to do with my realm. And maybe that's just, I just got it wrong and I didn't understand the situations. I just got very frustrated because I couldn't help but think there's things outside of my control that I can't influence, there's nothing to do with me, and I can't make the impact I'd like to because of these things, which is the complete opposite of the dentistry, where everything's in your realm. So yeah, if that answers the question.
So what kind of job were you doing in sports science?
So I was a strength coach.
Okay.
So you've got different disciplines within sports science. Strength and conditioning is the discipline of obviously getting stronger and getting fitter, and metabolic conditioning within sports science. And then you've got physio, you've got nutrition, you've got physiology, etc.
Okay.
Yeah.
So with the sports medicine, you can make more decisions then? Is that sort of the...
Okay, so this, I'm not sure I explained myself very well before. Maybe this will make more sense actually. I'm glad you asked that. So there is a spectrum from ultra fit athlete, gold standard sort of world record breaking physiology, performance, etc. And then you've the complete opposite end in my head, you've got disease, you've got pathology. So as a dentist, we deal with this. And I suppose you could argue that aesthetics, you sort of go in for the best result possible. If you're talking if you're referring to the sports science world, you would say that you've got the doctor's realm, get them disease free. They've fractured a bone, let's get them healthy. Then you've got the physiotherapy, and then you've got the strength coaching, and the sports coaching, the specific stuff. And I'm interested in all of it. I think the whole thing, the whole spectrum is fascinating. I've obviously done a lot of this realm within dentistry, and then a lot of this realm with strength and conditioning as a sports scientist. But I'm interested in the whole spectrum from a sport perspective. So that's why medicine is so interesting. And that's why I felt too restricted possibly as a sports scientist, because I find the whole thing interesting.
So what was the emotional journey when you were a dentist and you decided maybe your future wasn't in dentistry?
So it's not just my emotional journey, it's friends and family as well, because they can be very opinionated and they can find it emotional themselves. So that was interesting. So we've talked about this before, Ali, but I think my philosophy when I was, you make a decision to become a dentist quite early, or you can do. So age 15, 16, I made the decision, I want to be a dentist, that's what I'm going to do. And I think at the time, I decided my philosophy was going to be work to live. So earn enough money to do the things you like to do, enjoy your weekends, evenings, holidays, live comfortably, hopefully, etc. And then when I was working full-time as a dentist, it sounds ridiculous, but when I was 23 and working full-time for the first time, that was when it occurred to me, working full-time is so much of your life.
Yeah.
That you are going to spend, if you are a full-time dentist, you will spend more time with your dental nurse than anybody else.
Yep.
And that dawned on me, and then I realised, actually, do I want to do this full-time for the rest of my life? Am I passionate enough? Does this feel fulfilling enough? And it didn't. I knew within a couple of weeks that NHS general practice wasn't for me. So that, for me, it felt inevitable that I was going to leave, because it was so obvious that I had to. But for certain friends and family, they just didn't get it at all. They were like, what are you doing? You've just studied for 5 years and now you're throwing it all away, almost.
It's really interesting, actually, what you said about that full time, because I think I've been in a fortunate position where I did a gap year, but I worked in my gap year. So I worked full time for a year in more like admin-y, waitressing jobs. But it's one of the things I encourage whenever you get messages, from pupils and people thinking about going to dentistry. One of the things I always say is take a year out and work, or you can travel as well. But I think it's crazy that so many dentists go from school to studying and then their first job is dentistry.
Yeah.
And it's a huge job to suddenly do. And that's what I always encourage.
I think that's one of my reflections as well, is I can be quite an extreme person and I'm very all or nothing. Whereas when I've talked to people who are considering leaving since, because they've asked me, oh, you've done it, Chris, what do you think, what's your opinion? And in hindsight, I'd probably look back and think, I don't think I needed necessarily to be so extreme. There are halfway houses. You can go part-time. You can have a happy medium. But that's not me. That's not my personality.
Did you leave dentistry altogether for a while?
I did. It felt necessary for me. So when I was doing my master's degree in sports science, I was working in a coffee shop. And I think that was because I just needed a mental shut off to just be like, I'm dedicated to becoming a sports scientist.
Yeah.
So I was doing a lot of coaching, a lot of placements, a lot of studying, because I just wanted to focus on that. How long did I do that for? That was probably only something like 6 months to 12 months. And then I slowly started to reintroduce dentistry.
So how did that happen? How did the reintroduction to dentistry
I started doing a day a week again.
Yeah.
And started to enjoy it again.
Was that because opportunity came about, or was it necessity?
It made sense, just because working in a coffee shop didn't really compare to working a day in practice.
Yeah.
So it made financial sense, and also there was a curiosity there. I was like, I really liked some aspects of dentistry. I felt like I should give it another go, and I'm really glad I did. Yeah.
So what's your passion now within dentistry in your perfect balance?
Yeah, I love oral surgery and I love sedation, and that's all I do now. I don't do any general practice, and I'm passionate about those realms. So yeah, I really enjoy doing that now.
How did you find your way into sedation?
I was really lucky. There's a dentist called Nicola Taff in Cardiff. I started working in her practice, and it's something she did often. She was really good with anxious and phobic patients, and she did a lot of sedation. And luckily for me, she mentored me, and I started, and I really enjoyed it. So thank you, Nicola Taff.
That's awesome. Yeah, it always starts with a good mentor, doesn't it? And
Yeah.
actually, this is probably a good time to say that actually, Chris, you're Flo's sedation mentor.
I am, yeah.
And this has worked out really nicely because years ago, you would message me saying you're a roving sedationist.
Yeah.
And if we ever need that, to give you a shout. And as we've introduced more complex services like full arch work, we've realized the value of sedation within that workflow. And you came over and started working with us. And then Flo started thinking this would be awesome to do. And now, actually, the three of us work as a clinical team on some days, which is really cool. And I have to say, like, I didn't really understand the value of sedation before, but then good sedation and a good sedationist and that support within a team, Flo and I were saying it's just more and more people coming onto our team to take the burden off of each person. So we're all sharing it, and we all actually have a really nice day because we've got one thing to concentrate on rather than all the burden being on one person throughout a whole set of procedures.
Yeah, definitely.
So you do sedation for oral surgery on your own patients. How do you find that when you're doing the clinical work as well as the sedation versus just doing the sedation?
Yeah, it's a lot easier doing it for yourself, because I love working here with you guys because the communication's on point, and the culture that you have and the vibe that you have, it's very easy. Obviously, when you're working on your own and you're the operator and the sedationist, you have those internal conversations and you're aware of everything that's going on. Whereas when you're the operator and I'm the sedationist, it's so important to have those conversations about level of sedation needed, how's it looking at your end of the chair, how's it looking at my end, and it's hard to get that right. So that for that reason, I think it's easier to do it yourself. However, that's only for simple, straightforward cases. As soon as it gets more complicated and longer procedures, that's not a good idea. The recommendation would be actually let's separate the roles.
Have you found being a roving sedationist, you've had to reach out to more people, or people tend to come to you now, or?
And for cases, a bit of both. So I think what can happen is, initially the hardest bit was getting set up, and once you're set up, then you can get a bit of momentum, and recommendations happen, and I think that's what happens for me within Cardiff. I did a case with one dentist, and then it just grew and grew and grew, which is really good. But both.
Is there any type of clinicians who you think would make good sedationists versus other type of clinicians who wouldn't?
So sedation's often seen as the realm of special care, which makes sense. So special care dentistry, that makes sense. I think if you're really caring, really empathetic, really want to make sure that patient's getting the best possible experience, and you like more niche cases, I suppose that might be relevant. So I fell into it by accident, I suppose. But my experience was when I first started doing it that everybody was just having a better experience with those more difficult cases. So the nurse, the dentist, the patient, everybody would leave thinking that was more comfortable, that was more enjoyable.
Yes.
Nobody likes it when a patient doesn't like they're phobic or they're anxious, or it's not a very nice case or procedure, and they leave and they didn't really like it. It wasn't a positive experience. Nobody likes that. So yeah, that's my experience.
So I'm going to take it back now. You went to Liverpool for undergrad. How was
did.
that? I don't think we've had a Liverpool graduate
No,
on
we
yet.
haven't. Yeah.
How
Yeah.
was Liverpool?
I loved it.
Yeah.
I had a fantastic 5 years in Liverpool. Really, really liked it. Yeah.
I'm trying to think what they... I do apologise. The only thing I remember about Liverpool was when I applied, they were the bottom of the rankings table.
Oh wow! What year was that?
That was a long.
That was a long time ago, and
She's a different
it
generation
grew.
to us. Yeah, because we were the same. We were the same year, weren't we? Yeah.
I
I
mean,
think I got quite lucky because when I think I applied, they were lower, and then when I was there, they were right at the top, which made me look quite good. They were like, "Oh, you're in one of the highest ranking dental schools." I bet.
No, honestly, it's the same with, I think Cardiff was like 8th when I applied, and then it was first
Hold
in
on,
our
we have
second
to
year,
talk
and then
about
it
these rankings
jumped.
for a
I mean,
second.
they're ridiculous, so I really don't think it's anything to be
It's
like...
student satisfaction surveys, right? And what satisfies students? I don't want to start too early. Right? I don't want you giving me too much work. I don't want to stay too long. It's actually, in fact, you could argue that the lower down you are, the better the education you're providing, because it's probably that the students are having a tough time. Maybe that's just how I think of it.
Fair enough. I think they do base it as well on people's A levels. Like they look at the students coming in as well.
Do they really?
I'm pretty sure because they made us fill in some things. I could be
Okay.
very wrong here,
Okay.
but I think there is like a who's got the most A's, stars and things going in.
Okay.
Everyone's got A's going in. But yeah, someone can correct. If anyone knows anything, please message in. So you said after you sort of graduated from Liverpool, it was just go into general practice. Looking back, sort of what do you wish you'd gone into anything different then?
As opposed to dentistry.
Well, or like a specific realm of dentistry.
Oh,
you
sorry,
could
after
at that
Liverpool.
stage. Yeah.
I think your foundation year as a VT it was then, vocational
Training.
Oh yeah.
That was
Vocational
we were the
We were
first
VTs.
DF ones.
Oh, we DFC. Yeah.
We were the first DF ones.
yeah,
Yeah.
dental foundation year one. Yeah. So I think
Or were we the first DFTs? This
I have
keeps
no
changing.
idea.
Were you a
I'm a
DF?
I just call it a
DFT.
junior
You're a DFT.
dentist
We were
year
DF
now
ones.
because I get
Yeah.
So I think it's a good grounding, isn't it? Doing NHS DFT year. I think you can learn a lot in that year. But I think it completely depends on what practice you end up in.
Yes.
So that's one thing I would say to young dentists is just because you've worked in 1 or 2 practices even, you don't know dentistry. You can go to 5 different practices, you can have 5 completely different experiences. So don't let one practice put you off. No, I'm really glad about the decisions I made after Liverpool. Yeah, I think I was meant to leave and do other things and then come back.
Did you do your DF in Liverpool?
Barry.
In
So I
Barry.
came back to Barry. Yeah. Barry boy went back to Barry for dentistry once I graduated. Yeah.
Was that always the plan?
No, I think I probably would have gone south coast of England, but my mum had died the year before, so I just wanted to be home with family
Yeah.
and get back to Barry.
And so, if there are people going through that journey you went through where they've started in dentistry and they're thinking, actually, maybe this isn't for me, and they're feeling pressure from, well, themselves, the expectations of the people around them.
Yeah.
I know it's a really vague thing, but do you have any advice for people that are kind of going through that, or anything that you wish someone had said to you or someone did say to you, about how you get through that period?
Yeah. So it was one of the first, it was the most difficult crossroads I ever arrived at in my life, probably because it was one of the first as well. So I felt like the first mini crossroads was age 15, 16. You're like, right, okay, I'm going to leave school in a few years. What do I want to do? But you're in a really nice comfort zone, and I just continued with education. Whereas when I got to the end of my FD year, it felt like such a massive, it was a bit of an identity crisis, and it felt like a massive crossroads, and I sort of panicked. And I think I probably made lists and lists and lists of things that I liked and wanted to do and ideas. And I probably wanted to do it all at once and have a drastic change suddenly like that. So in hindsight, I probably would say to myself, you're only 23. Slowly, don't panic. You can just make one stage at a time, and you don't have to go all out. You can make small changes and see how it goes. I recently I say recently, it might have been a few years ago now, I talked to a colleague who was hating dentistry, was going to leave, and asked me, do you think I should cancel my GDC registration? And I said, I really don't think you should. Like, go away, do that ski season, come back, but you've always got that option then. If you want to do 1 day a week and slowly reintroduce it, you can. I know it's a £900-ish, isn't it? But you can get that back. Not that difficult. It's not that hard to earn that back as a dentist. We're very fortunate. The money is good. So it's worth considering keeping that. And then she came and grabbed me a few years later and said, I'm so glad you said that, because I'm a dentist again. I'm really enjoying it. I'm so glad I didn't cancel my registration. So yeah.
That's awesome, because getting back on that register is a nightmare.
Yeah, definitely.
That's great. And how so, because you're saying, okay, I could have done it slowly.
Yeah.
So you were full-time in general practice at the time. Mm-hmm. What would have been the alternative?
So, Joe, I haven't shared this much with people because I find it very personal. Just something I find really interesting about podcasts, and when you, I gave, funnily enough, in Liverpool Dental School, I was there earlier this year because they asked me to go back and give a lecture on career choices. So then that's why you guys have asked me to come in as well. So I was the wild card there as well. They were given all the different disciplines, and then it was Chris Chucas saying, this is Chris Chucas leaving dentistry, but then coming back and doing a little bit.
Can I just say, I'm really pleased you said your last name, because I didn't say it to begin with, and that was silly because I was like, I don't know how to say it.
It's not the easiest, is it? So what was I saying? What was the question?
You went back to Liverpool.
Yeah.
Well, I was you were going to share something that you haven't shared.
Oh, sorry.
before.
Yeah. So some of the reasons I left dentistry at the time I was quite embarrassed about, and I said there's that bit of identity crisis, and I find it quite personal to talk about that stuff, and I think I only talked about a lot of it at the time with very close friends and family, because of that identity, and because it's hard to be that vulnerable with everybody and anybody that you don't know that well. But what's quite interesting about podcasts or lectures is it's important, because you can, I always think you can give different narratives, can't you? You can give one version of the truth or a different version of the truth, but if you're going to stand there and give a lecture or do a podcast, I think it's important that you give more, as much truth as possible, because it'd be very easy for me to go, oh yeah, it was fine, I did a bit of dentistry and it wasn't great, so I just changed career. But the truth is, in hindsight, I had a great experience and I learned a lot, and there were loads of positives. But also at the time, it was really difficult because I've always loved sport and exercise, always been really passionate. And in my final year of dentistry, my identity was definitely tied into sport, exercise, socialising. I was going to be this dentist. and then I was this full-time dentist all of a sudden, and I had horrendous back pain. I couldn't do any sport, couldn't do any exercise. My evenings and weekends were shot, and that was the whole reason I wanted to do dentistry, was to sort of work to live. But I was working, and I felt like I couldn't really live my life because of all this back pain. And then all of a sudden I was thinking, I can't be a dentist anymore. So it was really tough at the time. I was like, right, I'm no longer this dentist. I'm no longer this sporty person. I'm just this broken 23-year-old with no career direction, and I can't enjoy playing rugby anymore. So it was really tough, and that was why it was such an inevitable decision for me at the time. I'm leaving. I'm not interested. I'm going to go down the sports route, which is, the paradox is that's my sort of work to live. So I became a strength coach and a sports scientist for much less money, but I love that. I love sport and exercise, and I find it absolutely fascinating. And on a personal level, it was really important to me that I rehab my back and I sorted myself out and I could enjoy sport and exercise again.
As a sports scientist, do you have any tips for dentists with back pain?
Goodness me, that's a whole podcast in itself. I think I could give you some snippets maybe, but you could do a PhD on that, definitely. What would I say? So,
before you say that, do you know what caused your back pain then, your particular circumstances?
yeah, so I was probably a ticking time bomb ready to blow up. So something called upper cross and lower cross syndromes, which I definitely had. Which basically posture and movement and how you move around. So globally I was quite strong, but when you looked at local levels, like my strategies for moving and being strong were probably very risky. So I had a very, I don't know what language to use here. Do I go layman's language or do I go
speak to the dentists who are
medical
listening.
diagnoses? So basically the arch in my lower back was very pronounced.
Yeah.
And if you'd have looked at me, so in Liverpool Dental School, I'd say the recommendations at the time were probably ill-informed. So my posture, if you looked at me when I was doing dentistry, any layman would probably be thinking, what great posture, because sport and exercise was so important to me, so I'd be very aware of my posture. But actually, my lumbar spine was way too pronounced in terms of its curvature.
You were sitting too upright in a way.
Yeah, basically. And I developed what's called facet syndrome, so my facets got really inflamed and really upset. And the problem with back pain is you can get yourself in a really horrible chronic state where there's a lot of spasm and a lot of pain, and it's really hard to get out of that, especially when you're in static postures all the time, 9 to 5, Monday to Friday doing dentistry. So yeah, I had bilateral lower back pain from probably facet syndrome is the summary, but lower cross syndrome probably contributed to that.
So if there are dentists sitting in practice and actually maybe at a young age who are having some kind of problem and they're a bit worried and they're going back and forth to GPs who are saying stretch, and who would you, now that you're in the industry you're in, who would you recommend that people go and see if they're having chronic issues?
So the first thing I would say is prevention is better than cure. So if you're a dental student and this stuff is important to you, I'd get on top of it sooner rather than later. Because if you can get into a good place before you even start full-time bending over and upside down, which is ultimately what a lot of us end up doing, obviously prevention is better than cure. You can avoid a lot of problems by getting it right in the first place. And I was so ignorant of all that. I thought I was quite fit and healthy and strong.
But who can teach you, Chris?
Yeah, so physios. So it's definitely worth, if you're a dental student and you're in third year, maybe ask for a birthday present or a Christmas present. Mum, Dad, I want a physio screen, and have a really good assessment and a really good conversation. Or a strength coach who really knows their sort of ergonomics and posture. Because obviously you could see a strength coach who specialises in Olympic weightlifting, which might not be that great. But if you see a strength coach who specialises in back pain or rehab, that might be great. But a physio, maybe with an inclination for strength and conditioning, might be a good shout to get that screen or get that treatment.
Do you recommend standing
I
rather
think
than sitting?
so. Motion is lotion. Variety is good. I probably would say 50-50 between standing and sitting if you can. But also it depends on the individual. There's different strategies. What's really important is, are you exercising afterwards? Are you moving afterwards? Are you sort of, if you're going to get a lot of tension in certain places, 9 to 5, what are you doing afterwards to loosen up again?
Walk to work, sustainable.
Yeah. And I guess, you know, you touched on it with part of the issue was when you're having this chronic pain and you're dealing with chronic pain and you're dealing with a loss of the social side and basically it's a mental health impact of all of this.
Yeah.
And so there's implications too if in the evenings, after we've been sitting all day or standing all day or putting pressure on our backs, to get out and be active, and there's a mental component to that as well.
Yeah, definitely. Yeah, to switch off and to get out of dentistry and just to relax 100%. Yeah.
I appreciate probably the best exercise is usually just something you enjoy, but do you recommend sort of like, I remember at dental school actually one of the lecturers recommended Pilates or yoga.
Yeah.
Do you think?
I'd probably say Pilates over yoga, depending on how you do your yoga. So you can employ Pilates principles or S&C principles to yoga, and it can be excellent for you. But done badly, it might not do any. It might not help. Might actually just make things worse. But yeah, Pilates can be great for core strengthening, and the principles there might be really worth understanding.
To then employ.
Yeah.
When you graduate and become a doctor and a sports medic, is it sports medic or
Sports doc. Yeah.
Sports doc. Do you think you'll still do any dentistry on the side then?
Yes, I do. So, by the way, that's one thing that's changed over the years, is I've had multiple crossroads, and now I panic less, and they don't seem as big, and they're quite exciting. And so when I came to the crossroads of, I've got an offer for medical school, do I go, do I not? It was very exciting, and I decided to go, and I think I've made the right decision. What was the question again?
I said, do you think you'll do dentistry after?
Yeah. So that's what I was going to say. So who knows what I'm going to do in the future? Well, we've been talking about sport medicine, but I haven't finished medicine yet.
Yeah.
So I've got 2 years after this one left of the degree. I'll have to do junior doctor years and then review. It may be that I don't want to do sport medicine. I want to do XYZ.
Yeah. Be an anaesthetist.
Yeah, and that's another reason why I want to do medicine, is because all avenues, so sedation and sports science and oral surgery, all three, I was like, medicine's only going to be a good thing because they're very relevant for all three. It's very relevant for all three. So who knows what the future holds? I don't know. But I suspect at the moment that I'd like to work in the world of sport within medicine. I love oral surgery and I love sedation, so I'd still like to do a bit of both. So yeah, maybe it's a bit greedy, but I'd like to do all three.
Do you find that people mostly assume that you've gone back to do max facts?
100%, which is obviously the logical conclusion. It doesn't make I'm a bit rogue, I'm a bit different.
It's an unusual journey.
But yeah, exactly.
So what is your sport actually that you unwind with in the evening?
Jack of all trades. I would love to mix it up.
I'm getting that vibe throughout the whole.
Yeah. Just not just on sport front. What's really nice about being in Swansea doing postgraduate medicine is the social aspect. Great, so I can do a different sport every evening because there's so many different groups. So at the moment I'm playing football. I'm playing mixed hockey, field hockey. There's a volleyball club. There's a run club. And obviously I'm right on the Gower, so there's road cycling, there's kite surfing, there's surfing. So I like to mix it up.
Sorry, can I ask, this is not as fun as Flo's question, but what's it been like going back to being a student and such an intense degree after having time away from studying?
Yeah, it's really interesting before I started because I really didn't know what to expect. I'm loving it, I'm really enjoying it. so much of it is so similar to dentistry. So that was bizarre. I think maybe it was the first Wednesday, went in, and there were medical protection stands and the DDU stands, but the medical equivalent. And I was like, wow, this is 2007 for me. What's going on? It's such a deja vu. And obviously so much of the content and the way to study and the way it's done is so similar. I'm just a lot older.
It hasn't been a shock going back to having to study and do all the things you do as a student?
No, not really, because I sort of anticipated it.
Yeah.
Maybe what I wasn't sure about was whether it was going to be the right decision. So at first I didn't tell many people at all, because what I didn't want to do was start the degree, realise I've made a massive mistake, and then tell everybody, oh, actually, I bailed, I'm not doing it. So I kept it really quiet because I didn't want
They'll
that.
just be like, oh, Chris again.
Yeah, exactly, yeah. But no, I've really enjoyed it, and I've made the right decision. Yeah.
That's awesome.
That's
Yeah.
really cool. I've really enjoyed this chat, but before you go, we've got a little quick fire quiz so that you can earn your dental pearl. And I'm sorry, there's not an actual pearl I can give you. What is your favourite procedure to do?
Lower right 8 MOS, surgical extraction.
Nice. What is your favourite scrub colour to wear?
Burgundy.
Oh, nice. I like that. With no context, which is your favourite tooth?
I think I already said, haven't I? That's sad.
The lower right 8?
No. Would it be? No. I'd say upper right 8.
Upper right 8.
Love 8.
I love how only dentists could like feel this emotional about this person. It's like, no, hold on. No.
Yeah.
I still think Jordan's the baby's first tooth was the most
That's
charming.
cute.
Yeah. And if you had to, I mean, yeah, maybe this is less relevant for you. I do apologise, but if you had to start again, what would you like to do?
Yeah. So actually, funny enough, when I was 15 or 16, the whole plan was going to be, right, I'm going to try and get into dental school, and if I can't, I want to be an entrepreneur. I'm not going to do the university route at all.
Mm-hmm.
I'm just going to work and be a businessman. So maybe that'd be my answer. But I do love business. I think it's...
What, is it entrepreneur? Is there anything you've got in mind to invent?
Maybe eventually...
I think you're confusing entrepreneur and inventor.
Yeah.
No, I know. All right. No, okay. Maybe
Innovate. You can be
innovate.
innovative.
Yeah. Well, you've got to bring something new to the table as an entrepreneur.
No, fair. Yeah.
Yeah, so I'd love to be an entrepreneur within sport medicine, but for the
Okay.
masses. So some podcasts or YouTube videos can bring to the masses what might be really specialised for elite athletes or strength training, etc. So that would be
The
amazing.
Huberman Lab equivalent.
Yeah,
That's awesome.
Yeah, something like that maybe.
Well, yeah. Thank you for coming in. It's
Thank
been
you
a
very
really good
much.
chat.
Very flattered to be asked. Thank you very much.
No, thank you, Chris. And I got to say, like, we are a growing team, and we have put a lot of time and effort into growing our team, and it's amazing how you walked in and the way you are with patients, how empathetic you are, how knowledgeable you are, how laid back you are. You support others in their growth, and I think as soon as you walked in, we kind of felt like we'd found someone, someone who's one of us. And I think the most impressive thing about you is that you don't protect your territory, and you don't try and show how important or how clever you are. You've tried to help everyone around you every time you've come in here, and I think I can see why on your path you keep finding places to go, because you just seem like the kind of person who's always trying to do better and make people around you better. So thank you for what you've brought to the practice as well. We really appreciate
Thank you very much.
Thank you, Chris.
Thank you for listening.